Hey everyone, today I have Trisha Talbot from Doc Properties in Scottsdale, Arizona. Trisha advises physician owners and investors about opportunities in the healthcare real estate asset class. Her track record in investment sales, landlord representation, corporate representation, and tenant representation offers clients trusted experience with competitive strategies. Aligning the real estate investment requirements of property owners and physician investors together with the corporate goals of the healthcare companies that occupy medical facilities has made Trisha a leader in the healthcare real estate brokerage community. Trisha lives in Scottsdale, Arizona with her wonderful patient husband and two gracious children who support her drive to make an impact, helping clinicians share their gift to heal others. She hosts her own podcast, Providers, Properties, and Performance.
Be the change you want to see. Make a difference by giving your money a purpose, a mission to do good. Welcome to Money with Mission, where we show you how to create passive income so that you have options for how to work and how to live your life while leaving a legacy of positive social impact.
Hi, Trisha. So happy to have you here today. Thank you.
Thank you, Felicia.
Trisha and I had a little hiccup. We were scheduled before. I was sick. She was gracious enough to come back today. So I really, really appreciate it. And I find that so many people are just that gracious. We all realize that life just doesn't go like we want it to go.
We're all human.
Yes. Yes, sometimes we wish we weren't, but it does happen that way. So Trisha, thank you so much. Trisha's company is Doc Properties, like we talked about in the intro. But you started with a commercial, but you had some education in real estate before you went into commercial. Talk to us about how you got to where you are today.
Sure. So going way back to my introduction into real estate, my mother and my aunts, they had a residential real estate company, and then they had some rentals that they did. I was not attracted to residential real estate for a variety of reasons, but I thought negotiating or losing deals over refrigerators and dishwashers was not necessarily going to bring me joy. So when I decided to get into real estate, I went into the commercial side, and I got into it. I was finishing up my MBA and I did a market research for a new medical office building for a medical office developer, a market research paper. And so I finished that, and then they had an opening in their leasing department. So I started there, did that for a couple of years, and then went into third-party brokerage, still all focused on healthcare real estate, and did a ton of leasing in my early career, and moved into investment sales from there. And then, just with my relationships with the variety of physicians and then getting referrals from them, I work in a lot of physician-owned real estate and selling that to investors in the medical office, healthcare, real estate.
You made that sound like it happened all in a year.
Oh, well, no. This is 20 years. This is 20 years of a lot of deals and challenges and successes all rolled into one, and learning from them.
So it sounds like, though, the very first lesson you learned wasn't a lesson you had to learn personally. You learned it through your mother and your aunt about not wanting to do residential. Were they investing and owning and managing, or were they doing the real estate sales?
So they did the transactions, and then they did hire somebody to do management. I think they were doing it on their own, and then they partnered with somebody to offer management as well. And then they did do their own, like they had houses that they rented. So
I talk to so many physicians who, when they start thinking about, I'm going to get into real estate, they talk about, I'm going to buy a house, I'm going to rent it out. And I know a few who've done that, and within a year to 2 years, they're like, this is nickel and dimes, and I don't want to do this anymore, especially when they learn more about commercial side. So how do you talk to people? Do you ever talk to physicians who are saying, I want to buy real estate, and talk about single family houses, or all the ones that get to you are already looking at commercial and buying something?
I get into all sorts of conversations. I get into marriages, divorces, children, everything. So I think it depends on what you want. And then obviously your access to capital is another, big thing. But there are some that, I know invest in multifamily. There are some that stay in the residential field. And, I think it depends on how much time and what they have set up in like standard processes. Like I went to a talk of a physician who invested in apartments, and he specifically invested in apartments that were between his home and the hospital where he practiced. And so
Okay.
that he could go. So in his early days, he, before everybody paid electronically, he would go, if somebody was late, he would go on his way to or from, his house or work and pick up their check. And then if somebody's like refrigerator broke, he had a number, he had a list of numbers for all of his tenants, and, they would call this handyman service that he employed. And then the handyman would have a workbook of, say the refrigerator broke down. He would say, okay, you can go to these stores and pick out, he's already picked out 3 different refrigerators that he's already pre-approved. They had his credit card on file, they would charge it, and, and all of that. So that's super structured, and you can do anything if you want to structure it like that. But, I don't know, in doing that, I think the biggest thing that anyone needs to decide, and physicians especially, because their day job is so typically intense, scheduled, and, I think when you're done working your day job as a physician, having to go and then spend, several hours doing a second job of real estate investing, I think it's a lot. If you're single, that might be fine for you. But even if you have a real estate background, I think, hiring professionals that can deal with the things during the day, and then maybe email you some decision points that you need to make as the owner. But, and this doesn't, it's independent of asset class. It's just, how involved do I want to be? And do I want to hire professionals, that can take care of this during the day? Because, inevitably, vendors, the real estate vendors, they start sometimes at 6 a.m. So they'll be done at 3. And they can't necessarily always commit to a time, because they get stuck on a job solving a problem that, isn't going their way. And sometimes they have to cancel and then come the next day.
Yeah.
So, if you have a buffer between, you being an owner, and hiring a professional property manager, or handyman or whatever, you have these things where there's a buffer between you being bothered in your day job in order to have income producing real estate.
And I think, what you're saying is perfect, because I think that many of us don't think that's going to be a big deal, but that becomes, even managing a manager becomes a lot. And when you look at, even if you have, let's say you have 10 single families, the income from that look at the headache compared to the income, it may not be worth it for you. So it's really something to look at. Plus the idea that what you talked about is having to get all the processes in place, even to manage a manager. So those things, it's very, very important. As physicians, we can be that picky and we can be that detailed sometimes. We do it all the time in our practice and our work, but to do it for something else, I'm just going to say, I would go with something else. Bottom line, I don't know that I would go with a bunch of single families. I still have 4 single families. I do. And sometimes it's a pain in the neck. I just don't want to sell them for some reason. But if you're starting out, I would start somewhere else. So let's say you have your own practice. So I used to work I was employed physician. My last group was an employed physician. I have owned a building that I worked in too. So I've done both of those types of things. But let's say they're private. We got private practice folks out there who are renting space and never really thought about real estate, or thinking about real estate, but don't think about it the way I think that you really would help them think about it in a better way. So talk about doc properties and in your company.
Yeah, absolutely. So I sell a lot of physician owned real estate, and I get it in a variety of conditions. And so sometimes it's a physician that says, hey, I've owned this for a while. I want to know what the value is. And, I have 10, 12 years left to practice. And what do I do with this property? Sometimes they just come to me saying, here's my property, tell me the value and tell me how I need to fix it. So with a lot of physician to own real estate that hasn't had a lot of structure in it, sometimes there's leases in place. A lot of times they've expired and they're month to month. Sometimes there's other tenants that aren't paying market rent and they're on month to month. There's some deferred maintenance because, sometimes in these cases, like a few partners will get together and they don't want to pay the management fee. So somebody raises their hand that they'll do it. But, they just the bandwidth to deal with all of this, they'd rather, at the end of the day, they're human, they're exhausted and they don't want to go and, worry about the HVAC system unless it breaks and then it's a fire and then they have to get called out and then, it's a mess. So
sounds like you've had some experience with that.
Right. So, so when I talk to them, I get their information and sort of take a look at it. And then I give them, depending on the leases that they have in place, it can sometimes be a short-term fix, or sometimes it's a long-term fix where they have to wait for tenants to expire. But the goal is to put a building on the market, its maximum value. I mean, medical buildings are, I find, interesting and unique because the value of the building is the tenants inside of it.
Yes.
Because it's the same with all income producing real estate, but in particular, the investors that are looking at this asset class, they're looking for, there are kind of local regional guys and gals that will purchase something with 5 years left on the lease. But typically the national buyers, the REITs, private equity, they're looking for, as close to 10 years, if not, sometimes they ask for longer, but, 10 years left on the lease. So if you're a physician and you're like, I've got 12 years left at the end, I would like the capital out of my building now, so that I can do other things in it, and they can invest in other asset classes. They can do passive investments into other real estate funds, either private or public REITs, and do a variety of different things. And then at the end of they sign a 10-year lease, and in 10 years, when they're done practicing, they don't have to worry about selling the building. They don't have to worry about finding a tenant to put in it in order to get the maximum value. So that's a sale leaseback opportunity that a lot of physicians do like to do.
So you're talking about, let me just wrap that around.
Yeah.
So you're talking, if someone comes to you already owning their building, they may have other people in their building that they're leasing to. Also, they may be the sole tenant in that building, whatever. So this person's been in practice for however many years, let's say 10 years. And they like what you're saying, they're in a practice. I know I want to practice for another 10, 15 years. Mm-hmm. However, I want to also pull the equity out of this building, or not, it's not even pulling the equity out. So they could pull the equity out by refinance, but they could also sell the building, which makes it attractive for investors at that point because they're going to still be a tenant in that building. Mm-hmm. So that makes it even an easier sell at that point, as opposed to if they're the only tenant, now they're done practicing the end of their life, end of their medical life, let's say. Now they're trying to sell this building. That's a little harder sell potentially, especially to investors, or you might have to sell it to another medical group because of the upgrades and things we had to do in our medical practice buildings. Is that where?
Yeah. So, when you're done practicing and, say, hey, okay, I'm done, and you move out, you have to then you have to find a tenant to backfill that space. There's tenant improvements involved in that. Now it's a 10-year-old space or even older, depending on, when you've originally built it out or the condition. If ADA requirements are changing all the time, so you may have to do some unexpected capital improvements. And then you can you hope that you get a tenant in there that will sign, a long-term lease, but typically if it's second generation, they're going to push back and only want to do about 5 years. So the most value, if you're a physician owning a building that you practice in, the maximum value you can get out of the building is to sign a 10-year lease yourself, get everybody else on as long a lease as possible, and sell the building then and get the proceeds, and then go and redeploy that capital in other places.
That makes sense. That makes perfect sense. What if you're out, you're practicing and you're renting and you're like, this just makes no sense to me. Kind of like you're renting your apartment. You're like, this makes no sense to me. How do we get into a building? Do we build? Do we buy something already there? How does that, what do you kind of recommend? I know it depends. So
yeah,
it depends.
So first I recommend having some runway. So before your lease ends, and I would say at least 3 years, just if you're considering developing, or if you don't know what the inventory is, at least you can do kind of a gauge at 3 years. And then, if you're like, no, I don't want to build, so I'm just going to buy. And then, maybe you revisit it another year, but you need to have runway. The worst thing to do with any real estate, but especially commercial real estate, is to have to be forced into a reactive decision rather than proactive, because it typically will cost a lot of money and you're not going to get what you want.
Right.
So if you do it on a proactive way, one, you have the negotiating ability to just walk away from deals if they don't end up going the way you want.
Yes.
Instead of having to live with a term that you find incredibly uncomfortable.
Yes.
So, and knowing maybe how big of a building you're looking for, if you're looking to have a space for your practice, maybe with some expansion, or if you're looking to occupy some of it and then have tenants as well. So kind of knowing what you're looking for, which obviously, you have to know how much capital you have to work with, because you need to have some sort of budget. Now, there are a lot of capital sources, a lot of joint venture partners in the healthcare asset class that specifically focus on partnering with physicians, because they know that they have to have a place to practice. They have to have a place for patients to come in. Telemedicine, I think gained a lot of traction in COVID, but it can only take you so far. You still have to examine patients in person for a lot of conditions. You have to, you can't perform surgery over telemedicine, so those have to be done still
not yet.
Yeah, right, exactly. But for procedures and for physical examinations, it has to happen inside of a space. And so that is why it's attractive to certain investors that focus on the space.
So are you doing office space, ambulatory surgical space, hospitals, all of them? Do you have a specialty in there?
So medical office buildings, urgent care centers, surgery centers, that's kind of where I live.
Okay.
For the most part.
Okay. Okay. And you said before we got on the call, on the interview, you talked about that you were very, very busy. What's going on? What's keeping you so busy? People selling, I'm sure all of it, but what's happening?
Well, a lot of people are selling. There's a lot of private equity money in the market that is, buying practices, and it makes them. So then, they're trying to figure out what they need to do with their real estate. And we are at the top of a market, and everyone's expecting, I think, a recession of some sort. So, and even though healthcare real estate is recession resilient, it will get affected, slightly.
Yeah.
So I think, that's the, right now we're at the top of a market. So if you've ever contemplated selling a building, now would be the time. It'll come back around, but if in the next 24, 36 months, you're like, I do want to make a change of some sort, right now would be a good time to consider getting your property evaluated and finding how much it's worth and kind of making those decisions.
So do you work with physicians who already have their set as far as their building or they're practicing and all that kind of stuff, but they want to invest in healthcare real estate because they know doctors tend to pay their rent. They know that this is not going to go away. We always need it. I was always going to ask you this. Are people buying smaller places because they're seeing less patients in the office now, or is that even a thing?
I haven't seen that. I haven't seen that yet. Because I think the single practitioner model is not incredibly common. Typically,
Correct.
it's a
Yes.
group and a partnership just for coverage purposes.
Yeah.
Because you're one person. And so I have actually seen, I mean, I think when I first got into this, 1,500 square feet for a single practitioner, I would do a couple of those. But now I think all of those guys have been purchased or employed.
You're in Arizona,
Correct.
Scottsdale, right? Okay. And do you consult in any other part of the country, or everything's in Arizona for you?
So I do. I represent owners and clients that have properties across the country, and I have a broker network for the local municipalities that I've done a lot of deals with, and they're great and know what they're doing. So I do, like, I help create a strategy, and then I work with local brokers to transact.
Got it. Now was starting to ask a question and I shifted. I'm going to go back because I still do want to answer that, and shoot, it just went out of my head. Investors. So if we have a lot of investors that listen to this who may be interested in investing in healthcare buildings, medical managed buildings, or medically occupied buildings. Do you have a place for them to come to be on a list and say, hey, if you've got somebody who wants to buy something, you talked about there's lots of private equity in the stream right now. How can they get involved in this? They don't necessarily want to practice in the building themselves, but they'd be happy to help somebody else get into a building and take a part of that for their own investment portfolio.
So that's coming with me next year, because I've had several requests for that. So, it's called passive investing. They don't necessarily want to be active, or they don't want to occupy it. Okay. So that's coming next year. In the meantime, if they do have some of that interest, I can point them in some directions.
Okay. Perfect. So in about a year, you will be able to, or not even a year, 6 months, sometime in the very near future, because
right.
This is what I'm realizing. I got 5 minutes. I can get this done before I take off. And the next thing I know, it's 10 minutes have gone by. So right. There you go. Right. Time's just going fast for me, and I think for other people too. So in the near future, you will have the ability to help people, passive investors, invest in the medical space.
Correct.
And we're going to tell you guys how to find out about that and how to be on the list and know when that's going to happen here in just a few minutes. You have a network of people so that if somebody lives in North Carolina and has a building they want to sell or they want to buy, they can still contact you and you can help them with that in some capacity. Yes. And yep. I've just picked North Carolina because I happen to know a few people in North Carolina, but any country. Okay, that's perfect. That's really, really good. I really like this and the mission with that, and Money with Mission. We're always trying to figure out how is that to have a social impact. If people can if a doctor can buy a building, or a medical practice can have a building in a place where there's an underserved community, that's a win for them, because now they own some property and asset and have a place for those people under that underserved community to come and get the medical care they need. Keep them out of an emergency room, because we know how much that costs, and get the care, get the real care. So there's a real need for this kind of thing. So more of us owning our own practices, owning our own, not just our practice, our real estate. That's a good way to me to get into real estate. If you own your own house, you're going to live in it, you know what that's going to look like. Own your own medical building, own your own building where you're going to practice, and get a big one so that you can now put some other people in there and make some rent from that. Now this is a good thing. This is an amazing thing for your portfolio. We had on the show a while ago Dr. Burns, who actually developed a hospital, and they ran it. Now they're out of it, but they still own the real estate. So that's just it's perfect. Now somebody got a long-term tenant in there. They own this real asset. You guys know what I mean by a real asset. I know you do. Not the paper, not the stock stuff that we don't have no clue what the heck that is. But you could drive by your building. That's real. That's what I'm talking about.
Mhm.
So if you haven't thought about that before, think about it now. If you don't want to own your own building because you're employed, somebody does, and there's going to become a time very soon with Trisha where you'll be able to connect with those folks and help them own their own building. Now you put that asset into your portfolio. This is a win-win-win, guys. So don't ignore this. Trisha, how can people get in touch with you?
Yeah, so my website's the same name as my company, docproperties.com. There's phone number, email, but you can click and on schedule a call, and you can schedule a call with me to talk to me about what you're wanting to do, and I can help you from there.
Okay, so if somebody's looking to start doing the investing, be a passive investor, are you wanting them to call and get on your list now, or is there another way for them to keep track of what's going on?
Yeah, so they can email it's info@docproperties.com, and we're keeping a list. But I have a podcast as well. There's a link to it again on my website. In the meantime, if they want to just sort of continue to understand there's a lot of investors that I've interviewed, so it lets them know what they're looking for in the market, for properties. I've interviewed physician owners, so you can see, some other physicians that have had success stories or not so successful stories. So we've talked through a few of those. And
what's the name of your podcast?
It's called Providers, Properties, and Performance.
Perfect. So Providers, Properties, and Performance is Trisha's podcast. I'm sure it's on all the platforms, wherever you listen to your podcast, you can find that.
Yeah.
And Trisha writes, there's blogs, there's so much information on her site about owning your own medical properties. So check it out. Everything's going to be in the show notes. I know nobody's sitting at their computer writing all this stuff down.
That's why I just give my website instead of all the details, because then it's easy for them to Google it and
yes,
when they're not driving.
Docproperties.com, easy.
Exactly.
Docproperties.com. You can do that. Remember to give your money a mission. Trisha, thank you so much for being here. I really appreciate it. And we'll talk to you again soon.
Thanks, Felicia.
You've been listening to Money with Mission. There are projects happening right now where you can have a great financial return while positively affecting the lives of others. To learn more about our opportunities, go to moneywithmission.com.